Gauteng healthcare workers say they're not only disappointed but also anxious after the rollout of the AstraZeneca vaccine was placed on hold. Now, Health Minister Zweli Mkhize says data shows the vaccine isn't effective in preventing mild to moderate illness from the variant dominant in the country. 1 million doses of that vaccine arrived in South Africa last week. Following the story for us, she joins us now live. So nursing unions yesterday told you they were disappointed with the news around the AstraZeneca vaccine, but you spoke to nurses themselves today. What are they saying?
Well, Shahan, really, the nurses that I spoke to today are saying that they're scared, to put matters short. They're very scared, especially after that announcement on Sunday that said that the AstraZeneca vaccine would not give you enough efficacy against mild to moderate illness. So they're afraid. They're more afraid because of the fact that they're in the front line. They were supposed to be the people who received the vaccine first. So it's mixed emotions, really. It's because they were excited at first to be able to start getting inoculated from tomorrow. They were excited about that. But after receiving the news on Sunday, now they're anxious. Some of them telling me that they don't even know what to tell some of their patients who ask them what they think about the vaccine. They're just really on edge, Shahan, especially because of the fact that they're hoping that the Johnson & Johnson vaccine will not be found not to work as much as we need it to in South Africa. That one being found at 85% efficacy. They're hoping that in South Africa it will still be able to work against the variant that is currently dominant in our country. But I did put together a short synopsis of the nurses that I spoke to, what they said, and of course what the union said in response to their feelings. Here it is. As the front line in the fight against COVID-19, health workers were supposed to start receiving jabs from Wednesday, but this is not to be. They say they are on edge about being the first in line, especially after Sunday's announcement.
As a health worker, my worry is too much on the money that is being wasted when making mistakes on this vaccine. Is the money that was supposed to go on the public purse and pay us and to show token on us.
We found out about this new variant before those vaccines were sent over to South Africa. It's not like we found out about the new variant here in South Africa when the vaccine was already here. Before it was shipped over, the order may have been placed pre-hand, yes. We don't know what happened, but they were supposed to put a stop to the shipment and asked for retesting to be done to make sure that this vaccine really will be effective for the variant that is in South Africa. Otherwise, what is the point of purchasing something that is not going to help the nation? And we, the frontline workers, are expected to even be at the forefront and get this vaccine first. I mean, how are we going to even be able to advocate for this vaccine to our patients? Because every day they walk in, they ask, so what is your take on the vaccine? And you find yourself not even being able to give my patients a confident answer and reassure them that there is hope, because even I don't have hope.
Unions say they are trying to alleviate fears among their members.
The question we are asking is, who is going to be rolling out this vaccine? Because we are always complaining about the gross shortage of staff, and the information in particular was not coming forth. That is why we were posing such critical questions. And again, we need to make it clear to people that we are not anti-vaccine.
We call for calm to South Africans and call the government to do a proper thing of educating our people properly, and not to make announcements that create anxiety and confusion amongst our society.
The 1 million doses that landed at the OR Tambo International Airport last week are expected to expire in April, while the Johnson & Johnson vaccine is expected to arrive sometime this month. Johannesburg.